Hello, and welcome to today's episode of Thrive After 45. I'm Denise Drinkwalter, heart whisperer, midlife mirror, and mentor. And every week I am so honored to share energy and space with inspiring guests whose stories reflect so many possibilities of thriving beyond 45. Together, we uncover the whispers of the heart, the power of midlife transformation, and the wisdom that fuels expansion. What happens when someone who has spent decades working inside the healthcare system suddenly experiences it from the other side as the patient? What becomes visible about the role patients play in their own care and the power of their voice within the system? Today, it is an honor and a privilege to welcome Dana Sherwin to our show. Dana, she brings a perspective that's been shaped both by deep professional experience and a profound personal journey. Dana has spent more than 35 years in healthcare management, executive leadership, and consulting, working across hospitals, managed care organizations, and 3 public accounting and consulting firms. She holds a Master of Health Services Administration from the University of Michigan School of Public Health and a bachelor's degree from Cornell University, and she is a fellow of the American College of Healthcare Executives. Today, Dana is a consultant and speaker focused on healthcare management and patient physician communication, and the founder and CEO of The Thinking Patient, an initiative dedicated to helping people become more informed, confident, engaged partners in their own healthcare decisions. Dana's commitment to improving the patient experience extends beyond her consulting work. She volunteers with the Blood and Marrow Transplant Clinic Trials Network, serves on the editorial review board for the Journal of Patient Experience, and contributes as a peer reviewer for the Journal of Healthcare Management. Dana's understanding of healthcare took on an even deeper meaning through her own health journey. She is almost a 7-year survivor of a stem cell transplant for a blood cancer disorder and an experience that transformed the way she sees the relationship between patient and the healthcare system. Dana, wow, what an honor and a privilege to welcome you to our show today.
Thank you so much, Denise. I'm thrilled to be here.
I cannot even begin to imagine. Maybe you could take us through what happened when you've had all the years of experience in the healthcare system and consulting and all of the knowledge you bring to the table around that. And then when you got news of your journey that you've now been on coming up 7 years. Tell us what happened there.
So, this was a real wake-up call for me. I knew I wanted to go into the healthcare field since I was a teenager because my father was in the health insurance industry and he had introduced me to many different kinds of careers. But I knew I wasn't really cut out to be a doctor or a nurse or direct care professional. But I really liked working with people and setting up organizations. I did a lot of that in high school and college, and I just knew that I was good at seeing things and in a way being a leader, having a vision of how things could work better. And so I married that with healthcare, and that's sort of how I got into the field. So from a very early age, this was very important to me. And as you know, young woman in the world, I wanted to do something really important with my life, and I really felt this was it. And
Mhm.
I was obviously gung ho for decades and even was able to get married and have 2 children. And then in my 40s, I started not feeling well and I just ignored the symptoms. I did many things wrong. And I was so focused on my career and taking care of other people. I was not really taking care of myself. I was not using any higher level knowledge that I probably had inside to say, hey, there are
Mm.
certain things that are not going well for me physically. I need to get checked. And many women find themselves in their 20s, 30s, 40s, and their main doctor is an OB-GYN. Well, that's not
Right.
really, that's an obstetrician gynecologist. It's not
Right.
really, people who, doctors who are trained in primary care, internal medicine, depending on who the person is. But OB-GYN should not be somebody's primary care physician. And that's where I found myself. And I was in the healthcare field for all these years.
Wow.
So what happened was that I was really like living my life, not knowing anything was wrong. And I started feeling pains in my stomach. And I was at my OB-GYN and getting an annual exam. And I said, oh, I'm feeling these pains. He goes, oh, I got a good gastroenterologist for you. Let me refer you to the person. And I did. And did a lot of tests. And he said, well, one of your blood counts looks really high. I want to send you for a sonogram. And I said, oh, is it an emergency? He goes, oh, no, no, just you go in there. So I go in there. I'm lying on the table, and the look on the technician's face like blew me away. He goes, I have to bring the doctor back in right away. It turns out I had a blood clot in the portal vein of my liver. It was a
Oh,
pretty big one. That's why I was having pain, because the blood isn't passing through properly.
oh my
So
gosh.
they said, we're sending you right over to have an MRI. I said, right now? Oh, yes, go to have an MRI. I went to have an MRI. They didn't say anything to me. I got back in my car. I'm driving home. I get a call from the gastroenterologist who says to me, do you have a hematologist? I said, why would I have a hematologist? He says, I need you to get yourself right to the emergency room. I'm going to recommend a hematologist to go see you. And as it turned out, I went into the hospital. I'll never forget. It was
Mm.
August 14th, 2003, because we had a big blackout that day. And I will
Oh,
always remember that the big blackout in New York. Actually, I think it was the whole Northeast. We had a big blackout. And it was a blackout, but I was in the emergency room. So the air condition, they had the backup generator, the air conditioning was on. But basically, just by all the symptoms, they
yeah.
diagnosed me with obviously having a blood clot, but diagnosed me with a blood cancer disorder. It was later confirmed by other tests,
Mhm.
but so that was pretty serious. Everything on the internet said you have barely like 11 years to live. So I
Mm.
was about 48 at the time, and they said you have 11 years to live. I mean, nobody said that to me directly. It was
Right.
what you found on the internet, which was pretty scary.
Mm-hmm.
So this whole thing was this life wake-up call. How did I not know? How did I not get care earlier? How did I
Mm-hmm.
not know? And obviously there's, more to the story in terms of my progression, because my stem cell transplant didn't happen till about 15 years later, because I was able to live fairly normally
Okay.
with this blood cancer. I needed to be monitored. I needed some other treatments, but no drugs, no nothing. And then the disease transformed into, from having too much blood in your system to having too little blood in your system. The bone marrow starts shutting down. So you get to a point where, and there's no cure for this disease except
Mm-hmm.
for a stem cell transplant.
Mm.
So I avoided having a stem cell transplant for many years. Doctors wanted me to go earlier, but my
Mm-hmm.
kids were still in high school. They were about to
Mm.
go into college. My head was wrapped around so many things for my family, and I was still feeling okay until I wasn't.
Oh.
And when my health crashed, I had really no other choice. And I was very fortunate that the National Bone Marrow Program was able to make a match with my blood. Some people can
Yep.
use siblings, but
Yeah.
I couldn't. And so they did make this wonderful match. I will be forever grateful to this donor. And it's an amazing, wonderful program that serves people, around the world. And
Right.
so my stem cell transplant was successful in 2019. 6 months later, we had COVID. We had some issues getting care during COVID, but basically I was okay. And over the years, my health, I got started getting stronger and my health started getting better. But I was really not in a physical or mental
Mm,
condition to think about returning to the work life, the
hmm
professional life that I had before.
hmm hmm Those pieces, there's one thing that keeps coming through loud and clear, and it's probably because the premise of our show is based on this, but how we as women, well, yeah, there's a niggling, but you know what? I can push through. I got this, right? Everything you
Mhm.
spoke about. And then, well, my children need me because the care, they're at peak times right now in high school, moving into, postgraduate kind of thing. It's like, ugh. What advice, what learning can you share with our audience? Because I am sure those listening have their hand up going, and nobody can see me, but I hear you because that's what I'm doing right now. I think it'll disappear. I can do this until I really have to. What advice do you have based on your experience?
Okay, so there are a couple things that I know I did wrong, and then other things that I learned along the way.
Sure.
And so obviously my background in healthcare administration and my master's degree did not help me at all as this, that the
Yeah.
experience of being a patient is a totally different thing than really understanding how a healthcare system works. But once
Mm-hmm.
you are a patient, you understand really the understanding of how the healthcare system works is helpful. I'm not saying it wasn't helpful
Of
in my
course.
communication and everything. So basically, it boils down to one, as I mentioned, have a primary care physician,
Yes.
internist. I don't know if they have a different terminology in Canada than they do in the United States, but it's really important that you have somebody who you're connected with, that you form a relationship with, that sees you
Mm-hmm.
at least once a year, more
Mm,
often if you're pre-diabetic, you have high cholesterol, if you have any inkling of anything else, because that relationship is so important. Somebody you
mm.
feel really comfortable speaking with, sharing who you are. Now, a lot of people have problems sharing who they are, and it's not even that those kinds of problems, but an OB-GYN isn't trained to ask
Of
those kinds of
course.
questions and to get
Yes.
into that. And to someone for a doctor to understand in a way, what is your home environment like? What's your financial situation like? And I'm not saying the details of your tax returns,
Of
but what I'm saying
course.
is, what's your insurance coverage? Can you afford the medications I'm prescribing? If not, let me help you
Mm,
find a social program to help you pay for those medications. Or do you need a support group for your particular chronic illness? Or, okay, so all those things, that relationship is so important. And, some people are luckier that they find somebody early in their life they get to stick with. And then eventually the doctor will age out or you will age out. You'll need a different kind of doctor, right?
right. Yeah.
um, when you're older, and I found this out also, I was fortunate that somebody referred me to a geriatrician. And I don't know if they have geriatricians in Canada, but doctors who they're internal medicine, family practice physicians who specialize in the care of the elderly. And you say elderly, it's just older people. Maybe even you could be
Yeah.
50 and seeing
Yeah.
a geriatrician. So important because these doctors are trained to understand that certain diseases progress differently in older people than they do in younger people. Certain medications have an effect on older people versus
Mm,
younger people. The mixing of different medications, having that knowledge. Is this an age related issue or is it some type of genetic issue?
right.
What is it? They are trained to know this. And really, a few years ago, I was fortunate that I needed a new a new primary care doctor because my
Right.
insurance changed. And when I was referred to this doctor, and he was the geriatric specialist, I thought, oh, I think this will really work because I have a complex
Right.
disease process, and I need a doctor who's also going to communicate well with my
Yeah.
hematologist oncologist, who is the doctor that I see the most frequently. And so having the right doctor and forming that relationship early, I'm talking
Yeah.
about in your 20s or at least in your 30s, find a
Hmm.
primary care physician. You find a pediatrician for your children, and you could spend
Right.
hours, days, weeks finding, let me see that right doctor, or I don't like the way he speaks to me, I'm going to find another one. Well, spend that same time finding
Mm,
your own doctor who you're going to have this relationship with and that explains things well to you, is connected in access ways to the healthcare system. So that's number one. Number
yeah.
two, there's so many genetic testing
Hmm.
opportunities available to people these days. And 20 years ago, there wasn't really as much. Things have changed.
Right.
Medicine and the field of genetic medicine has advanced so much. In fact,
Mm,
genetic medicine has advanced far beyond the ability of practicing doctors to keep up because it's so
wow.
huge, which is why some um, big hospital programs will have its own separate genetic science unit that some doctors will then refer people, okay, why don't you get this panel of genetic tests? And the main purpose is not to scare the living daylights out of
Yeah.
somebody. The main purpose is to identify areas where you may be at risk where
Yep.
you may be at risk. And it's not just breast cancer anymore, it's all kinds of cancers or other kinds of disorders. And what are your tendencies? Now, it may just say, oh, you're at average risk, which is a great answer. I'm at average risk. It
Yes.
still means you're at risk, but you're at
Yep.
average risk. So if the test shows that you're at higher risk, this is something for you to pay attention to. So
Right.
that's the doctor's number one, genetic testing is number two, and number three, you have to be the CEO of your own health. You have to be in
Thank
charge
you.
of your own health. You have to be the one who knows the most about you.
Hmm.
And so this was interesting. I learned this recently, some statistic, sort of like how it all sort of all the pieces of the
Yeah.
puzzle fit in together. But
Right.
supposedly 85% of diagnoses that a doctor makes, they don't even
Yeah.
need a test, and they don't need a test or just based on the description of the symptoms that the patient is describing to the doctor,
Ah,
meaning the communication between the doctor and the patient is so important. So
yeah.
going back to being the CEO of your own health, you need to understand need to understand your conditions, the medications you're taking. If
Hmm.
something is off for you, you probably need to like journal it, track it, monitor it.
Yes.
People who have migraine headaches are really used to doing that because they're seeing like a pain medicine doctor and the doctor tells them, okay, it'd be helpful if you then track the pain that you have so we can follow and what are the conditions under which the headache is worse, what makes the headache better, how long does it last. That could be applied to anything that's an aberration to your health.
Hmm.
Keeping your own records and your own journal so you have sort of an evidence-based discussion with your doctor about what's going on with you. And also, to the extent that you can then not withhold any of the sensitive information that a lot of people withhold from doctors, like how much do you smoke? How much do you drink?
Right.
What do you take any drugs? Do you supplement any sexual
Yeah.
practices that may put you at risk?
Yep.
If you more open you are, or even as simple as, and I like to tell this story because like a lot of people can relate to it, if you are a big like coffee drinker and you stop drinking, you would just say, I don't want to drink coffee anymore. You stop drinking coffee suddenly. And then all of a sudden, maybe like a few days later, you're having tremendous headaches.
Yeah.
And I'm going to go to the doctor. I'm not feeling well. And you fail to tell the doctor that you stopped drinking coffee. The doctor will say, have some coffee. Your headache will go away.
Right.
So that's just
Exactly.
sort of a
Yeah.
very, general example of why it's so important. I mean, if you're taking supplements, vitamins,
Yeah.
all these things, you need to tell the doctor. You want the doctor, one, to have a real good picture
Yeah.
of what is going on with you physically,
Hmm.
mentally, psychologically, environmentally, all that kind of stuff. To the extent of your
Hmm.
ability, you should do plan that in advance so you're very
Yeah.
succinct because you know how short, I don't know, in Canada, are the doctor's appointments like 15 minutes long?
Yes. Yes.
Okay,
Yes. Yep.
so that's a real issue.
Hmm.
I think that it's important. It's also important for the doctor to know that you're focused and organized, concise, and
Yep.
that you are want to be in work in partnership with that doctor. So these
Right.
are very important things.
Yes.
You
Yeah.
can even, I got asked a question recently. Well, what if you're shy and you don't like really talking to people you don't really know? Well,
Hmm.
this is a little bit of a different situation talking to a doctor because you're doing this for yourself.
Right.
You're not doing it the interaction is not about to make an impression or to have, the interaction is about you, all about you. And so it's basically comes back to taking care of you. And
Yeah.
shy people can, when you prepare in advance, then you can actually read from a script. The doctor doesn't
Right?
care. The doctor wants you to know that doctor wants to see that
Yeah.
you really care and are focused on your
Yeah.
own health, and that whatever the doctor will recommend,
Yeah.
through a discussion and understanding of what a patient needs, that you will follow through,
Exactly. Yeah.
that you will show up for appointments,
Hmm.
that you will take your medicines that are prescribed, that you will let the doctor know. So I would say those are the three things that have really crystallized for me going through this personal health journey.
Yeah. I really admire and love your context around take your notes, go in, read the notes. It doesn't matter. That's the real black and white. And when we do something, and when we present, we are being the CEO of our life and our health. And so you are becoming your own advocate, just like you shared. You hunt around for your pediatrician. Why would you not do the same service and give yourself the same opportunities that you do for everybody else in your family? Right. So I love what you're saying because I also suspect, I know when I do, right now, very rarely because I'm very fortunate, but I know that can change at any moment. But when I go into the doctor, if there's something that's been going on, I try to stay right on topic. I don't get into the emotion around what might be occurring. And that's sometimes hard to do. But if you have your anecdotal notes and you're just reading them, it helps you stay probably like you're talking, the focus piece, right?
Absolutely. And
Yeah.
look, it's okay to be emotional,
True.
um, but to be controlled.
Yeah.
So you're emotional, your doctor
Yeah.
knows you're a real person, you care about your health. If you
True.
don't stop,
Yeah.
whether it's crying or not being able to speak, then it's really
Right.
hampering the process. And the fact
Sure.
is that this is your time, this is doctor's time, is very valuable time. It's like you have this
Right.
resource in front of you that you want
Yes.
to take advantage of. It's
Yep.
like you go into an expensive restaurant and it's this beautiful meal and it's expensive. This is the same way you're sitting with a doctor for 15 minutes. This is a meal for your
Yeah.
health, that
Yeah.
take advantage of this opportunity. So come back to, I'm doing this for me.
Yeah.
And I do want to get out of here in 15 minutes because I don't
Yeah.
like seeing doctors, right? Nobody likes seeing doctors. Nobody wants
Exactly.
to know there's anything wrong with them.
Of
I
course.
experienced this. I really never knew. I had family members that were always getting sick, or this happened, or that happened, or this accident. Older
Yes.
people, younger people. It was like I never wanted to go there.
Yeah.
I watched my weight. I watched
Mm-hmm.
the food I put in my mouth. I tried to
Yeah.
exercise. I tried to do all the things so I wouldn't be sick. Well, as it turned out, I had a genetic blood cancer
Yes.
disorder that was out of my control. And it turns out it wasn't inherited. You can get genetic malformations in your DNA
Mm-hmm.
post birth due to environment or other aspects of your own makeup, your own
Yeah.
personal makeup. There are a lot of diseases that may be genetic that are not necessarily inherited, and that's the
Wow.
disease that I had or have, or I don't know. I guess they call it remission. So I'm
Okay.
not recovered. I'm in remission. I do not have a blood cancer disorder right now because I have the beautiful blood of a stranger who donated
Yeah.
this blood to me.
Amazing. Amazing. Is there a question that you feel people should always ask their doctors? One question.
Yes, so this question has come up for me recently as well. And I actually have two answers to this question. But the first
Okay.
answer that I think is probably be the most surprising to people is ask the doctor the question you are most
Mm.
afraid to ask. What is the
Mm.
question you are most afraid to ask? Whether it's, how is this going to affect my life? What does this mean to my health?
Mm-hmm.
What are the risks of
Mm-hmm.
this? What else could I be doing?
Mm-hmm.
How can I make it go away?
Yeah.
How long am I
Yeah.
going to live? All
Yeah.
those
That.
things. Will I
Mm-hmm.
pass this on to my children? What is the question you are most afraid to ask?
Mm-hmm.
And you can Google it or put it through AI. You can put all this, ask the question to AI, but you should
Right.
always ask the doctor this
Mm-hmm.
question. What are
Mm-hmm.
you afraid to ask?
Mm-hmm.
All right. And so the second question that I would
Yep.
answer, you should always ask,
Yep.
what else can I be doing to improve my health? So
Okay.
you go through all this thing. I have these symptoms. He diagnoses you. You're going to go for these tests. You're probably going
Yeah.
to get medication, all that. It's like a lot. It's still a lot.
Yeah.
You should always say, what else should I be doing to take care of my health? And what should I be looking out for? And
Mm.
how should I communicate with you in between appointments
Ooh,
if
good
I
one.
experience any of these things?
Very, I love those. Wow. I can feel a shift in my body as you're sharing those questions because what's coming through for me is exactly what you talked about at the beginning, becoming the CEO of your own life. And there you are taking ownership. You are asking the hard questions to get clarity from the doctor's perspective. What is it that needs to be done that I have control of? Love that. Wow. So beautiful. Is there anything that you would love to share with our audience that we haven't talked about that you think, you know what? If I can leave you with one more golden nugget, this is it.
Well, I have many, but I'm going to pick one. So
That just
I've been
means we'll
doing
bring
this.
you back on the show. That's
Yeah.
all.
Yes. So I think that people don't realize how important it is to prepare for their appointments with doctors. So take the time a few days
Mhm.
before your appointment. I mean, I know in the US, sometimes it takes months to get an appointment with a specialist, right?
Yep. Yeah. Yep.
And so you have months in a way to prepare. And there's a lot of ways to prepare for an appointment, but it is so important and to write it down in sort of an organized way
Hmm.
so that you can develop your questions. What should I be asking the doctor?
Yep.
What previous tests you might have had that you want follow up on, or you want to understand how it might relate to some other thing that you're feeling or thinking about. What kind of if it's a really very complex disease, what kinds of research are being done around the
Hmm.
country to um, maybe offer you an opportunity to, well, not just participate, but maybe benefit for some of these
Hmm.
trials that are going on.
Hmm.
Um, you want to also share other things that other doctors have told you. And the way to really have it all done in a focused, concise way is to put
Hmm.
it in writing. And if you
Yeah.
do have a time, and even if it's a few days before the appointment, as things come to mind, then you have time to
Yeah.
write it down and include it on the list. What are your questions? What's the follow-up? You may want to ask the doctor about experiences with other similar patients. You
Yes.
may
Yeah.
want to ask the doctor about patient communities and the available patient communities and support communities
Mm.
to help you through your journey.
Hmm.
People with diabetes, with different cancers, with rare diseases. You want to, if left to, unfortunately, right now, it's left to every individual to do their own like preparation. I mean, maybe AI in the future, or for people
Right.
who are really on top of things, you put in AI and you can still do this. What are the questions I should be asking my doctor? But the preparation is really important, and
Hmm.
for two reasons. So, one is that you come in focused on what you want to accomplish to that
Hmm.
visit. You have
Hmm.
this agenda And so you also want to let the doctor know that you've prepared this in advance, but we could discuss it as we go through it, or we could get back to it, or does he or she want to hear everything first up front? But it relieves you of the
Yeah.
issue of memory. But first,
Yes.
by writing it down, it will be embedded in your memory to a great degree. You write it down
Yep.
over even a couple days, you reread it before you go into your appointment, it will be embedded. It frees up your brain to have that interaction so you
Hmm.
could react and interact with the doctor. As the doctor's
Mhm.
talking, you can say, "Oh, I don't really understand that. Could you explain that to me better?" It
Yep.
frees your mind. And,
Hmm.
you know, a lot of people understand the importance of decluttering, right? Decluttering because it
Yeah.
frees the mind to open up other possibilities. I mean, there are obviously decluttering specialists and life coaches who
Right.
really teach people methods for decluttering. Well, this is another decluttering method that is
Yeah.
so important for your health. So when you're in that appointment, you are focused and you are engaged and you can ask those questions and interact or even say, you know what, I don't really understand. I need to think about it some more. Can you give me other resources? But you need to free your brain. And
Hmm.
you know, I also suggest that people in the appointment write little notes down so they
Yes.
don't forget. I think that's important. I always go to the doctor with a notebook on my lap.
Hmm.
But I would
Hmm.
say that preparing for appointments and writing things down are
Hmm.
just so important for you to be mentally prepared.
Yeah.
It's about and not just like this physical preparation and practical preparation. It's
Yeah.
also for the emotional strength and
Yeah.
courage to go into it's like you're going into a test.
Yeah.
You're going into this test
Hmm.
prepared to the best of your ability. Whatever it
Hmm.
is, it doesn't matter. And there's
Yeah.
no failure, there's no
No.
downside.
Yeah.
And because every time you do this, you just get better and better and more confidence
Yeah.
each time you do this.
Yeah. It's exactly what's coming through. The more you practice, the better you're going to get at it, right? It's not going to be as foreign. One thing that I know we did, it was really intense. Our mother-in-law was diagnosed with brain cancer and it was stage 4 and the whole thing. So because I am a note taker, I couldn't keep up and I asked for permission to take a voice note. And then I was able to share it with family who were overseas at the time, and they said they approved that. So that's another avenue that if everything is too much and the doctor says it's okay, but you have to ask permission to do such, right? But it's another avenue I've used in the past, and I've still have the voice note today. Yeah. So I don't know if you've ever done anything like that, but I know for me that that was helpful when I had a lot of information coming at me and I knew the appointment, it wasn't, a very minor thing. It was a life altering, changing thing that I knew I was emotionally charged. And so was a family that was able to be present. So that was a helpful piece when the doctor also said, yes, you can do that.
Yes.
Yeah.
So I think, yes, it is definitely on the list of things that you could
Hmm.
do to make the process go smoother. You could also ask a family member or a friend to come to take notes,
True.
right? But
Yeah.
I think the voice note thing is great. And
Yeah.
I've rarely heard that a doctor will say no to that.
Yeah.
Right.
Yeah.
Particularly in
Yeah.
this era where doctor practices are using AI
Yes.
dictation more and more. So,
Yeah.
you know, it's basically you're doing it to ensure that you have a complete record of
Yep.
that visit. So I think that's a great
Yeah.
idea.
Yeah. Yeah. Dana, we are so honored to share in your brilliance. There's a reason always I feel that connections have been made and we've been brought together to have this conversation today. And I believe in my heart that there are so many people listening, women, men, doesn't matter. This journey is so important for you to be the CEO of your life and your health. And it starts today. Anytime you decide this is going to be happening for me, and your experience, not only with your work life, but your own unfortunate series of events that you couldn't change. It just was what was happening in your body, and you are responding to it. And I'm sure there's been quite the journey and there will continue to be, but I'm glad to hear that you are in remission. We are so happy for you. And it's been an honor to have this conversation and share space with you. Keep doing your incredible work. You are so involved in so many incredible organizations and supporting so many people with your wisdom. We will have in the show notes how people can find you, because you've given so much great advice. Like the tips you've provided are actionable and doable. And when we become, again, our CEO of our own life and our own health, we can't do anything but better ourselves just through this knowledge. So thank you again for being here. It's been an honor and a privilege to have you
Thank you
with
so much.
us.
Thank you, Denise. Appreciate it.
Before we close, I do want to share something that's been coming through and it is being organized behind the scenes. It is in November. I am creating a live in person experience called Ignite the Inner Uprising. It will be a 2-day immersive gathering for up to 1,200 women in midlife years who are feeling a quiet pull towards being more embodied, tuning into who they are as a person, as a woman, not with all the roles that they currently identify themselves through. So, Ignite is an extension of these types of conversations where reflection becomes embodiment, insights start to become integrated, and where women who have held so much for everybody else gather to stand fully in your own sovereignty. So, if something in our conversation stirred in you today, wonderful. We are honored to be part of that. And if your body has been leaning in, that's not an accident. The wait list is open now. So if Ignite feels like something is available for your future self, we want to thank you and we want to invite you to add your name to the wait list to find out more. The link will be in our show notes. And as always, make sure you share, follow, leave a review so that more women can find these incredible conversations. There will be a place for us to gather. Have a wonderful day and thrive after 45.